Juan Carlos.
Y somos Tercer Cielo.
Hola, ¿qué tal amigos? Soy Benjati.
¿Qué tal amigos? Te saluda Funky.
¿Qué tal amigos? Le habla su hermano Michael Rodríguez.
Hola, ¿cómo estás? Te saluda Marcos Vidal desde España.
Hola, les habla Marcos Witt.
Hola, soy Ingrid Rosario.
Hola amigos, les habla Harold Guerra.
Todos ellos, sus mejores canciones y muchos más hacen parte de la programación de Aliento Radio. Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Welcome to another podcast of Avatar Home Health and Hospice. Today with us, we have Maya Arguez. She's our Director of Marketing for social media. And she's going to introduce the topic today, and hopefully she'll keep me in the right course about the because I tend to go to different topics, but hopefully she'll keep me in track today. Maya.
That's a big task, but I'll try. So today we kind of touched on this last time we were together, is introducing palliative care.
Yes.
So that's one of our newest services. So today we're going to really dive into that. What is it? What differentiates it? How does it compare to home health and hospice and all those things? So again, let's just start simple. Why don't you give us a brief explanation of what is palliative care?
Oh, okay. So palliative care is one of the most confusing terms that we have nowadays. And when I say nowadays, is that, say, 15, 16, 17 years ago, plus or minus, when you talked about palliative care, you were talking about hospice. Because palliative care is synonymous with hospice. So somewhere along the line, the different type of palliative care came into being, which is the palliative care to take care of a patient that has a chronic illness, not terminal yet, but they need help with mainly pain medications. So the doctors now can go and visit that patient at home under palliative care, and they get reimbursed by Medicare or the insurance company, and they prescribe medications for that patient. However, if you look at the definition of palliative care, you're going to find that palliative care is taking care of the comfort and pain control and that type of service. Now, that type of service is also true, like I said before, in hospice. But if you really want to get real confused, then you can say that palliative care is also given in home health. So are you confused enough, Maya?
Yeah, we're going to have to dive into that a little bit more.
Okay.
So first things first, the biggest thing is the confusion with hospice care.
Right,
So
right.
where does it differentiate between hospice care and palliative care?
Okay, that one is easier to define.
Yeah.
Because under the newer rules, palliative care, when you say just palliative care, it's going to be not for patients with a terminal illness, but for patients with a chronic illness. In other words, there's no cure for that illness. Mm-hmm. So that encompasses from cancer, heart disease, kidney failure, any of those chronic illnesses that there's no cure for them. Even though cancer, sometimes you can go into remission.
Right.
And but they're not going to die anytime soon, mm-hmm. right? The dementia, Alzheimer's, a patient could be with dementia for 20 years.
Right.
Where in hospice, the patient has a chronic, but it's a terminal illness, right? And the patient is not expected to live more than 6 months. Mm-hmm. So not only has to have a terminal illness, but it's a terminal illness that if the patient, that illness takes its normal course, the patient is going to live approximately 6 months or less.
Right.
So that doesn't mean that the patient, when it gets to 6 months, we're going to discharge them from hospice, but that's the Medicare guideline. So in one hand, we have a patient that can live for a long time, but he still needs palliative care in reference to pain management and comfort and all of that. On the other hand, you have a patient with a terminal illness that's diagnosed to die within 6 months or so.
Right. So another question I think that is important to answer is, does someone have to stop treatment to receive palliative care?
You're talking about aggressive treatment for that particular
For their illness, yeah,
illness.
whatever it is,
No.
that's the chronic
No,
illness.
in palliative care, no, in the contrary, they're gonna have the whatever treatment the doctor, and not necessarily the doctor that's seeing them for palliative care, because that doctor most of the times is gonna be only taking care of the pain medications, and maybe another medication, but mainly pain medications. Now, most likely that patient is going to have a specialist that's seeing him for whatever chronic illness he's got, plus all the other illnesses, all the other problems that he might have. He might have his own cardiologist, oncologist, pulmonologist. You know, he could have many, many doctors. He can still see all these different doctors, and together with palliative care.
Right.
So yes, he can still follow and get aggressive treatment for that illness.
And so with that, what is the goal of adding palliative care to these aggressive treatments and these?
The main goal is that the patient doesn't have to be going to a doctor for like pain management. And that's really the crux of the matter is the pain, controlling the pain. Many of these specialists that the patient is going to are not comfortable, or they do not want to prescribe controlled substances, in other words, pain medication.
Right.
Because if you tell somebody, well, I'm gonna prescribe you Tylenol 600, that is not gonna do the job when that patient needs to be on a stronger medication. And that's where the doctors kind of draw the line. They don't wanna be dealing, if you're a cardiologist, you don't wanna be dealing with pain medication. The same goes for the pulmonologist. You know, nowadays the doctors are very much in whatever they do. And the pain medication is not their forte or their specialty. They're going to refer you to a pain medication doctor, pain management doctor. And then the patient, most of these patients, even though they're not going to die anytime soon, they don't want to be going to 20 doctors at the same time. So that is one less doctor that they need to see, because the doctor is going to come and see them at their home. And what I'm talking about, that normally palliative care is coupled with home health. Because normally a patient in palliative care, not 100% of the time, but in many cases, they're going to need a nurse, they're going to need a home health aide, and they're going to need other services that the palliative care doctor cannot do.
Right.
So normally they're combined with a home health. Once that happens, the difference between home health and hospice becomes less, because then they're getting the nursing and the home health aid that they will get in hospice.
So kind of going off of the pain meds that, a lot of times that conversation can be scary to people.
Right.
Why, if this doctor's wouldn't want to prescribe it, why should I talk to another doctor about it? So kind of how can you relieve that concern they might have?
It's very simple. It's got nothing to do with the medication. It's got to do with the regulations. Once you get into the controlled substances, Now you're dealing not only with Medicare and all those bureaucratic kind of regulations we have to deal with, but now you're dealing with the FDA, right? Now that's the Drug Enforcement Agency. I'm sorry, the DEA, Drug Enforcement Agency. And what are they looking for? They're looking for doctors that are over prescribing pain medication to put them in jail. So doctors say, whoa, I'd rather don't do anything about that. You need pain medication. Once they have to go into controlled substances, they go, okay, go see this doctor, a pain management doctor. And that's the way that they get out of it. So it's not, if you fall into that, in a case like that, don't think that pain medications are bad for you. If you're in pain, you need them and you should take them. The problem is that the reason the doctor doesn't want to deal with it is because they don't want to get involved with the Drug Enforcement Agency, DEA. And now it's very, very much under scrutiny. They look at everything. They look at prescriptions. And we deal with that. We deal with that in the hospice side. Mm-hmm. So very much. So, and also in the palliative care side, but most of it in home health, they keep count of everything. So you do have to be careful. And that's the reason why doctors don't want to mess around with pain management.
Right. And the doctors we work with, they specialize in this, so they're more comfortable with it, and they know the policies and procedures that are needed to prescribe the right medication and all that stuff.
Correct.
As well.
And also there's a relationship, like our medical director for our hospice side. He's been working with us for like 10 or 12 years. He not only is he an expert in pain management, and he not only is he an expert in hospice, but he's been working with our team with 12 years. So he knows that when our nurses talk to him and say, oh, this patient is in a lot of pain, maybe he needs something stronger, what do you think? He knows that then our nurses are being very careful to control the issue of pain medications. So a lot of it has to do with that relationship between the medical director and the nurse team.
Right. So now to kind of dive into the relation to home health when it comes to palliative care, can you talk a little bit about what that looks like and what palliative care, what services are included with that?
Okay, that's an iffy kind of thing, because if you go, like everybody today, they have a question, what do? They Google it, right? So if you go and Google it, you Google something, what is palliative care? And then they're going to give you I don't know what definition they're going to give you, but whatever you get there is not going to be 100% right. So with palliative care, you normally, the main thing you're going to get is the visiting doctor to take care of your pain management. And, he will prescribe other medications too, but if the patient doesn't have an issue with pain where he needs controlled substances to take care of it, I don't think that patient will be in palliative care. So, but normally a patient, if he's got a chronic illness, normally he needs more services than just the doctor.
Right.
So that's where the doctor refers the patient also to a home health agency. And the home health agency, the doctor only comes once or twice a month. The home health agency is going to come and see that patient 2, 3, 4 times a week, depending on the needs of the patient. So number one, you're going to have a nurse, that the nurse is going to make sure that the patient is taking the medications correctly. Not only the medications that the palliative care doctor is prescribing, but all the other medication the patient is getting from the other doctors that he or she is seeing.
Right.
So she's doing that. She's teaching the patient about the different areas of his disease, the things that he should eat, not eat, that he needs to do more exercises or not, be more active. And then also we get the home health aide. The home health aide, usually the main job of the home health aide, which by the way is a certified nurse's assistant, is to help the patient take a bath safely.
Right.
Even if they don't give the patient a bath, at least they can walk him into the bathtub, and help him get into the bathtub, help him get out of the bathtub, because that's probably one of I would say maybe the number one cause of accidents. When people think about accidents, people think about car accidents. No, most of the accidents happen in your home. Mm-hmm. And then if you want to get more exact, most of the accidents happen in the bathroom.
Right.
Why? Because it's water, it's slippery. You have the bathtub, and an elderly patient has to get over the border of the bathtub, so it becomes a little bit dangerous. So that's the CNA can be there to help them, and if they need help taking a bath, getting the complete bath. Here normally these are women normally, and she will do that if the patient needs if the patient is bed bound or wheelchair bound and doesn't want to get out and get into the shower or the bath. We can give him a bed bath, and then we can also include therapy in that home health care. So so the patient gets a more complete care with home health, and that brings us to, unless you have something else there.
No, that's okay. Go ahead.
Because so when you have a doctor for the pain medication and you have home health there. That is, like I was saying before, that's very similar to hospice. So what are the main differences between hospice and this, let's say, palliative care coupled with home health? Well, you're also going to get the doctor, the visiting doctor, but he's going to be looking at other things besides pain management, right? Because you might have a wound care, and he's going to get involved with the wound care. You might have a UTI, and he's going to get more involved with the UTI, and so he's going to be more in more areas, be involved in more areas, because you don't have in hospice, you're not going to have that specialist to go to, because you're basically close to death. Then you're going to get all the medical equipment you need. You're going to get all the medical supplies. That includes incontinence supplies, wipes, gloves, lotions. And when you talk about diapers, they can be very expensive. They are very expensive.
Yeah.
So the agency is going to be responsible to provide the patient with those. And then on top of that, the medications. Any medication that has to do with hospice, we're going to pay for it. So the patient doesn't pay anything. There's no deductibles, no co-payments. We don't have to bother the insurance company for the patient. We're going to either bill Medicare or Medicaid. We're going to be reimbursed. We never, ever send a bill to the patient. In home health / palliative care, then they're going to be using the pharmacy that you currently use. If they're co-payments, you got to pay the co-payments. If they have limitations, you got to deal with the limitations. The same thing for the medical equipment. The medical equipment has to go through a doctor. All the prescriptions have to be written the right way, otherwise Medicare is going to kick it back. The medical supplies is not covered by Medicare. You have to go through Medicaid. If you don't have Medicaid, now you got to pay it through. You have to find a way to either get it through some program, or you got to pay out of pocket. And like I said before, I bought a packet of diapers for my great-grandkid. And believe it or not, I have great-grandkids now. And he sent me back like $35. And I go, my goodness, this is expensive, right? So with hospice, it's the most complete, comprehensive service that a patient can get.
Right.
However, to qualify for hospice, you have to have a terminal illness where the doctor deems that you're going to die within 6 months or so.
So just to clarify also, does insurance cover palliative care?
Palliative care will be covered by some insurances, but they're the same that like with home health. We have to take it as an agency in Avatar Home Health and Hospice. We take it on a one-to-one case. So we have to go, who is the insurance company? Are we in network with that insurance company? If we're in network with that insurance company, then we have to look at the patient. What kind of insurance do they have with this insurance company? Mm-hmm. Do they have deductible? Do they have co-payments? So, yes, insurance company might pay for it, and a lot of them will pay for it, but before you do anything, you have to have either your doctor's office, or your home health office, or agency, or hospice agency, check your insurance, and that way you know upfront, which is what we do. If you were to come with us for home health care, even with palliative care or without palliative care, it doesn't matter. We would talk to the insurance company, and if you have a deductible or a co-payment, we will tell you up front, and we will tell you, is $40 a visit or no? No, there's nothing. Now, most of our patients are 65 years of age or older, which means that they're Medicare beneficiaries. And with Medicare plans, with Avatar Home Health and Hospice, in 99.9% of the times, there's not going to be no co-payment and no deductible for you to worry about.
Right. Okay, so as we finish up, if they have questions, if someone's curious about palliative care, hospice care, home health care, where do they find you?
You see, we leave it for the end, and I forget about giving my number. But my phone number, and I mean my personal cell phone, is 281-703-8050. 281-703-8050. And we forgot to tell you that we've been in business for 21 years. It's a family-run agency. We take care of over 500 patients in the greater Houston area. We serve a very large area around Houston. If you live anywhere close to Houston, the Woodlands, Cleveland, Montgomery, Pearland, Katy, you name it, you call me at 281-703-8050, and I will tell you exactly what we can do for you. And if we cannot help you, we will find somebody that can. With that, we thank you for tuning in again to another podcast of Avatar Home Health and Hospice. I thank you, Maya, for being my right hand, keeping me in track. And we shall see you soon.
See you next week.
See you next week. Yes, we do this once a week. But where can they look for us?
They can find us on Instagram, Facebook, LinkedIn, YouTube, all at Avatar Home Health and Hospice.
In about 6 months, I will learn to say all of that. So until then, we'll see you, and God bless.